And welcome back. Welcome back to OpenLine. We are talking about the Affordable Care Act. This is your chance to call in with any question you may have about are you eligible, how do you sign up, what works best for you. Happy to have with us people who can answer those questions. And I want to ask about TennCare. Many people are on TennCare. There's a major thing going on in our state right now involving TennCare. What's happening?
So right now, TennCare is going through a redetermination process. So prior to the implementation of the Affordable Care Act, when folks were on TennCare, every year they got re-verified. So they had to reapply every year. Because folks can no longer go to DHS offices and apply for TennCare in person, it's all done through healthcare.gov now. When that started, the re-verification process kind of got put on hold. So there has not been a TennCare redetermination process since January 2014. So it's been quite a while. So it's new. A lot of folks have been on TennCare since then and have never gone through the process before. And this time is also different because, like I mentioned, there's no in-person help as far as at DHS. So we do assist with that as well. TennCare is sending out redetermination packages to folks who have TennCare right now. It depends on the person's situation. A lot of people are getting letters that they simply have to sign if nothing in their household has changed since they first signed up. So if they're still, a mom with 2 kids, for example, same household, she still has the same job, same income, she can simply sign the form and mail it back in, and her TennCare should continue. The important thing is to sign it and mail it back in. If you fail to do that, then you'll be put into another tier of folks who are going to have to completely reapply through a longer process. So if you get a letter from TennCare, it's very important to open it and read it. If you have any questions about it, you can call us at Get Covered Tennessee and make an appointment or speak with somebody who can help you understand what your next step is. Hopefully you just have to sign something and send it back in. But if you have had a change in income or household, we can make an appointment with you. Some folks may be earning more now than they did when they first applied, so they were eligible for TennCare. Now that they're earning more, they might actually be eligible to purchase insurance through the marketplace. So we can help them transition from TennCare to purchasing insurance through the marketplace.
The thought would be if there's a redetermination, there are going to be a lot of, well, not a lot, but there will be some people potentially who won't get TennCare, who won't be put back on TennCare. And so that's a concern.
Yes.
For a lot of people. And is this something that you couldn't miss if it came in the mail? Or would it be easily overlooked?
Well, a big thing is to make sure that TennCare has your most recent address. So try to think back to where you were living when you first got TennCare. If you've moved since then and you haven't reported that change to TennCare, you're not going to get the letter. So an important step is to make sure TennCare has your most up-to-date address. You can call Tennessee Health Connection at 1-855-259-0701 and just make sure that they have your accurate address. Other than that, you can't miss it as long as you're opening everything from TennCare.
So that's pretty important too. I bet a lot of people, there are probably a good number of people who have moved. So yeah, this is very important. Okay, that's good information. Let's go to Angie. Hello, Angie.
Yes.
Hi, go right ahead.
Hi. Well, I have a question. It's actually for my son. He hasn't been on TennCare since he was 21. He lost his TennCare at 21. He is a diabetic. He needs insulin on a daily basis. He has tried twice to apply for the Affordable Care Act enrollment, and both times they have told him that he does not make enough money. So I was wondering, what can he do to get some sort of insurance? Because right now he's getting his insulin from the Solid Center. Other than that, he can't get any other kind of services whatsoever.
All right, thank you for the call, Angie. Yeah, so here's 21-year-old told he doesn't make enough money,
Right.
can't get coverage.
Right. So unfortunate. Basically, they're really saying to him he doesn't make enough money to qualify for help paying for his coverage, and when you don't make enough to qualify for help paying for it, it would be very unaffordable. So they're giving him the standard insurance premium, which he can't afford because he doesn't make enough money. He's considered in the gap if he doesn't fit a 10-care category. So in Tennessee, you have to fit a 10-care category: pregnant, disabled, or the parent, caretaker, relative of a small child under the age of 18. If he doesn't fit one of those criteria, then he's not going to be able to keep his 10-care. So he's in the gap because I can't get the 10-care over here because I don't fit a category, and over here I don't make enough money to qualify for the advanced premium tax credit, so the government will help me pay my premium. So I'm in the middle. And that's why we need Medicaid expansion to help those people that are in the gap. Unfortunately, there's nothing he can do right now as far as either paying the full price premium on healthcare.gov, or we do have a program at Family and Children's Service, Health Assist, and they will be able to help him maybe find a medical home, a primary care doctor, maybe find some free or low-cost medications, screen for other programs, maybe refer to some safety net clinics, those kinds of things. And the Health Assist number is 615-313-9972. And if he would just give the Health Assist department a call, he may be able to find some assistance there.
So we'll put, well, there are some of the numbers, and I'm looking for the Health Assist number.
It's on the bottom there.
It's on the very bottom. Okay, so that is, and this affects a lot of people. So Angie, your son is not alone, sadly.
Yeah.
And he's in a situation where he needs insurance. He needs insulin. Insulin's very expensive.
Sure.
But he doesn't make enough money, so he's in what's called the gap. How many people are in a situation like Angie's son in the state of Tennessee? Approximately, do we know?
There's about 280,000 folks who are in that same situation. So
that's a lot. That's a lot of people. Okay, Angie, thank you for your call. Let's go to Joe. Hello, Joe. Hi, Joe. Go right ahead.
Hey, the question that I wanted to say, I'm almost a disability recipient, which I got the Obamacare right now. And I'm concerned if I will have to re-enroll if I get what's called the award letter, if I'm approved with that. Is that necessary for me to enroll that type of insurance with the condition that I have right now?
Take that, Mary.
Are you going to have to re-enroll?
Right. Well, I got Medicaid now.
Right.
The Obamacare, I'm getting back for the doctor. I can't work no more. So
okay.
I just was, the enrollment is necessary for me if I get the award with that.
Okay. Now, do you understand?
it sounds like if you are receiving 10 care, you don't have to re-enroll right now, but you will want to be checking your mail quite frequently and opening any letters that you receive from 10 care, because they are doing a redetermination process right now. If you're on Medicare, do you know which one it is?
Medicare.
Is it Medicare or 10 care?
Yeah,
do you know?
Conventional care. Yes, it's conventional care.
I'm sorry? If you are on Medicare, then you should be fine right now. You don't need to do anything. If you have a plan through healthcare.gov, you can re-enroll right now, or you can keep paying your premium and your plan will automatically re-enroll. We do encourage everyone. We do encourage everyone to re-enroll, to redo the application, just to make sure that all of your information is up to date. And you can get an appointment with a navigator who can help you determine whether it will be in your best interest to re-enroll or whether that's necessary. And to get an appointment with a navigator, you can call our 844 number. It's 844-644-5443. That's the number to get an appointment.
And we'll put those, well, there it is again. There's the top number. So that would be to make an enrollment with a navigator. And Joe, that's why I'm glad people call in. That brought out a lot of good information. So if you already signed up, theoretically, you don't have to call in again. You just keep paying, and you're gonna be okay. You're not gonna get the penalty, and you'll maintain your coverage.
Yes, you will start paying a new rate. So the insurance company will send you a bill saying this is your new rate based on the information that we have for you right now. Now, what a lot of folks find is the number that their insurance company gives them is a little bit higher than what they've been paying.
There have been some stories about that.
And
Yes.
if they come back and re-enroll, the tax credit that they're receiving usually goes up a little bit to compensate for that, and they get a better deal.
There has been some sticker shock. People get a letter and they are quite surprised. The remedy for that is to call in and hopefully get a different plan that'll be less expensive.
That's one option, to switch to a less expensive plan. They may even be able to stay in the same plan, but because their information is updated, they'll become eligible for a new tax credit amount. So it'll it will help alleviate the stiff increase. But yeah, that's very important. When you get that first letter with your new premium, don't panic, cancel, think you'll never be able to afford it. Please call, let us help you reapply and see what you're eligible for this year. One option is to switch carriers. We have some new carriers this year. We also have some carriers who've been around in the past, but their rates haven't been very competitive, and this year they are. So switching is an option too.
Okay, all right, we're going to take a break. Tony and Tina, stay on the line. If you want to call in with your question about your situation, give us a call, 615-737-PLUS, 615-737-7587. Take a break. Be back right after this.